Hi, Paul Wakolbinger here with a multi-part series on distal bicep surgery recovery. I saw a lot of videos online that people have shared, and they were very helpful, but I thought I would share my experiences with you because I'm a little different than some of the other videos that were posted online from the standpoint of I'm 52 years old, where many of the videos were posted by people in their 20s or late 20s, early 30s, and many of them have been personal trainers or bodybuilders. While I am in shape and I do work out and go to the gym, I am certainly not A, that young, and B, to the level of fitness that some of those individuals were at in the prior videos. So hopefully this will be helpful for you as I share my experiences. So a little story. 3 weeks ago, I was helping a friend move a boat dock. It was a quite heavy object. We were all pulling very hard. I was pulling upward, almost like you'd be trying to lift your car, and there was a snap in my elbow. I knew immediately that I hurt it. I fully expected my bicep tendon to be rolled up into my arm and be disfigured like you have seen other people do. However, I did not do that. So I went home. I was hopeful that I just really tore or ruptured that tendon and didn't rip it off the bone. But unfortunately, after a few doctor visits, an MRI to confirm the fact that I did rip it off the bone about an inch, and surgery was required if I wanted to really use the arm in any meaningful way. So 3 days ago, I went in for surgery. It is about a 45-minute procedure. My physician did not knock me out with general anesthetic. He just gave me some drugs to make me sleep and instead did a full nerve block from my shoulder down through my fingertips, in which case the arm was completely numb 18 hours after the surgery. The surgery entailed cutting about a 1-inch incision. I'll show you that on the next video, right below where your arm bends, in which case he went in and fished out the damaged ligament and trimmed off any of the frayed areas. He then took a Kevlar-like string, wrapped that through and laced it through the tendon so he could use it as a pulley mechanism, if you will. Then proceeded to drill a hole through my radius bone, fish that string through, and then pulled the tendon tight up against the radius bone where it was initially attached. From there, they put me into a cast like this. I think you can see it, where that fit on my arm, and there was an ACE bandage wrapped around it. So I was at 90 degrees and not able to move my arm whatsoever, and I was in a sling. The strange thing after this surgery, while there was no general anesthetic, so I didn't have that groggy feeling, but my arm was completely numb from the standpoint of my brain would tell my fingers to make a fist, and I wasn't able to do that. It was very odd, very strange. My brain would tell my body to move my arm up like this, and it just wouldn't react. So that was quite unusual, quite uncomfortable. It was a numbing feeling as well. That said, there was no pain at that point because of the nerve block. Within 18 hours, that nerve block does wear off, in which case mine did in the middle of the night, and that's really when the pain started. It was fairly intense, certainly very manageable, but it's not very fun, to say the least. The pain medicine that they did give me, Percocet and Norco, worked well. I was on that for about a day and a half, and then I really didn't need it anymore. 2 days post-surgery, I went and saw a physical therapist, and she fitted me with this brace. So they cut off the hard cast and fitted me with this brace that allows them to control the extension of the elbow joint completely. So most of the videos that I saw, people were locked in at 90 degrees. I am locked in at 60, which is a little bit further. So the benefit here is it allows you to move your fingers, it allows you to move your wrists, it allows you to move your arm back and forth to keep the muscles and the tendons moving in the arm so they don't shrink and get any further atrophy than they're going to have. So it's quite easy to use. I'll show you next time on how to take it on and off, but it's pretty straightforward, and it's easy to do with one hand. I am able to take it off the shower, which is a good thing, and you just keep your arm either in a sling and shower in a sling, or as what I've started to do now is just keep it very close to the body and be extremely careful so you don't slip and fall when you're in the shower. Again, no pain whatsoever. I do have a few exercises that they're having me do in terms of inflection and supination and pronation of the hand. But again, the pain has subsided after 36 hours post-surgery, which is good. And unless I really move the arm in a certain way or try to pick something up that's a little heavier, like a plate of food versus a glass of milk, that can cause some pain. But once you immediately take the pressure off of it, the pain goes away. So this is going to be a long recovery. I wanted to share my experiences with you. I will do another post here in a couple of weeks. I will be in this brace for 30 days. And then after that, I will be on an honor system with absolutely no weight whatsoever on the arm. And then if I'm in crowds or in a public setting, he would like me to wear it in a sling, my arm in a sling, just so people will know, hey, there's an injured arm and somebody doesn't grab my arm and pull on it. So that is it for now. I will keep you posted in a couple of weeks.